We now are actually going into our next fireside chat. And I have the privilege of being joined by the platinum winners. And so I would like to introduce Beth, who's already here. Hey, Beth. Beth, who's here with Moving Analytics. And then also I'd like to welcome Kip McCoy with OSF Healthcare. I think, Kip, you'll be joining us here any second now. There we go. There we go. Kip, great to see you.
You too.
Fantastic.
Thank you very much.
Fantastic. So Moving Analytics, congratulations. So proud of you. And let's talk a little bit about your journey in getting into MassChallenge and how did you decide and what kind of went into the impetus to be a part of MassChallenge Health Tech?
Sure. And thanks so much. We're really honored to receive that award, and I'm, really glad and happy to be here today. MassChallenge has an incredible reputation. It's an incredible organization that's not just, Massachusetts and Boston, stretches across the country on its impact and also an international. So it was great to also be in a cohort with, folks from outside of the U.S. Why MassChallenge? It's high impact and high value for entrepreneurs. With Nick Doherty's leadership, you have a tremendous team of folks that are invested in your success. They're your colleagues, your mentors, your strategic advisors. And they have really best-in-class content and curricula. So whether you're participating in the AMA ROI programming, or you're just really looking to learn more about or understand best practices as you test your business model, you have incredible support there. With COVID, the program did not miss a beat. And I wanted to share just an example of what MassChallenge brings to you. We were on a programming call and all of the startups were asked to just give a quick update. So I shared that week we were making progress on bringing in a payer that would cover the Moving Analytics solution. And so I got off the call, and about 10 minutes later in my Slack was a huge list of stakeholders at health systems in that region, potential customers. It's just really amazing that you have these folks on your team. They anticipate what your challenges will be, and they're right there to support you along the way. So just can't say enough about the commitment to the cohort, the sponsors, and ultimately, in the case of Moving Analytics, the commitment to the patient and their families.
It's fantastic. That's great feedback. And under Nick's great leadership, who I'm a huge fan of as well, but he knows how to pick and work with the great companies and also great sponsors. And so with OSF Healthcare, Kip, be interesting from your perspective, as I'm sure you get pitched a few times, a few ideas from different startups. Maybe talk a little bit about what goes into you selecting what startups you want to work with.
Yeah, that's a great question. And I want to echo the comments about MassChallenge and really the preparation that goes in from their side and bringing forward these incredible companies that make building those relationships that much easier. But for us, we really are looking at our individual strategies, the things that we're trying to solve for from a health system. Here in the middle of the country, we have a large rural population that we're often trying to serve better each and every day. And so there's a lot of considerations for those types of patients and us trying to serve them. And in terms of working with Moving Analytics, being able to deliver those cardiac rehab programs to those rural patients was certainly one thing that came to mind for us. And one thing that Nick mentioned earlier was, looking at those health disparities and being able to provide programs that are so important, like these cardiac rehab, is really critical for us to be able to reach those patients. So those are a few of the decisions that, in ways that we look at engaging with startups, we want to make sure they align with our mission and align with our strategy, and bring in the right leadership from our side as well.
Right. No, great points. And in fact, think about the key therapeutic areas that are very sensitive to, rural health, or even in light of things like COVID. As Beth, you actually mentioned, being part of a cohort in the middle of a pandemic. Can you maybe talk a little bit about what it's like working in this program and how COVID impacted this relationship and even your time in the MassTech Health Tech Challenge.
Sure, and maybe I'll just start real quickly for those who are in the audience who maybe don't know what cardiac rehab is. So after a cardiac event, it's a Class 1A recommendation to complete cardiac rehab, and this is a evidence-based program with several decades of evidence. The patient after the event will enter a program. They will identify their risk factors and then learn how to manage those risk factors. So we have a program with over 25 years of evidence that we've rolled out. So it's digital and it can be delivered anywhere, anytime. So with COVID happening, and I think most of the digital health companies in MassChallenge, we really had that opportunity to push those solutions out there. There were a lot of the restrictions were eased. There was reimbursement. And so this was very accelerating for us. And to be able to also, what we saw was a lot of interest from the commercial payers to cover the solution. So in the time of COVID, we drove our solution even further and had more success in serving patients, but we also could deliver a program when centers were closed or even now as capacity is somewhat limited. So, it's COVID has, helped to really accelerate the growth of telehealth.
Right. Absolutely. Absolutely. And the ability to adjust pretty quickly in the midst of a pandemic, and especially as demand went through the roof and the opportunities did as well. So Kip, I'm going to ask you to take us home and talk a little bit about, for other partners that are looking to work with health tech startups, what advice would you give them based upon your experience of working with Beth and MassChallenge?
So I would say it's important to be flexible and working with startups. It's really for us, we want to make sure that we're providing that a shared value between us and the startup. So it's really looking for where can we have that, where can we find that alignment where both us and the startup are going to benefit, and really thinking critically about that and working with startups that are open to coaching, open to feedback, and being able to play off of each other's strengths. There's certainly, as a health system, there are things that we can bring to the table to help, and we want to be sure to accentuate those things and be able to leverage the resources that we have and the things that we can do to help the startups as well. So I would say it's important to think about how can you help build that value for what's ultimately going to be hopefully a fruitful and long-term relationship.
Yeah. No, fantastic. See around flexibility and value as you just share with us again. So with that being said, I want to thank you, Kip, for your comments. Beth, congratulations again. Outstanding job.